Frequency. So every now and then I'll get someone come into the office and they'll be complaining that they go to the bathroom all the time. They may go to the bathroom now, and a half an hour later they go to the bathroom again. And then half an hour later after that they go to the bathroom one more time. So that's called frequency. Frequency means going to the bathroom with a high frequency. So in men, frequency can be caused by several different things. Certainly, the most important thing, as a first step of understanding what's going on, is doing a bladder diary. So we need to know, when you go back to the bathroom, are you going back and voiding a small amount or a large amount? So do you keep going back because your bladder is not emptying the first time around, or is it because you're making too much urine? So you could be making so much urine that you keep going to the bathroom, and all you have to do is understand why you're making so much urine. And it's not necessarily because you're drinking too much, or even if you are drinking too much, is it because you're losing too much urine that you're drinking to make up for it, or you're drinking too much water, and because you're trying to get rid of that water you drank, then you're voiding too frequently. So these are sort of like volume problems category. Another category of problems that can be giving you frequency is because, let's say there's something irritating your bladder from the inside. For example, someone could have a bladder stone. Let's say they have a bladder stone, and the bladder stone itself is just sitting in the bladder, and then every time it knocks down on the wall of the bladder thinks, oh, I have too much to urinate because it's a stimulus for the bladder. Well, the bladder doesn't know the difference between a stone and too much urine on the inside. So you could be going to the bathroom because you have a bladder stone and it's making you go to the bathroom. Or even worse, you can have a bladder tumor. The bladder tumor can also be irritating to the bladder. Or a large prostate. The large prostate could be irritating to the bladder itself and make you feel like you have to go to the bathroom. But every time you go, well, only a little bit comes out because the bladder wasn't actually full to start with, and is being irritated from the inside out. Another reason that you can have frequency as a man is with age, the prostate grows larger, and as it grows larger, what happens is it starts compressing the urethra, and when it compresses the urethra, now the bladder, which is basically a reservoir trying to empty out the urine, it needs to generate higher and higher and higher and higher pressure. Because if you think about it, in order to get the urine out, you need to have the bladder squeeze, but the prostate, which is sort of sitting right at the, sort of like a gateway to the rest of the urethra, well, if the door is closed, you need to push more with more force to get the urine out. If the door is wide open, then you don't need to push as much. You can just relax and the urine empties out. And why would that give you frequency? Well, what happens is with time, as the bladder starts to force, and every time you have to pee, it's like a workout for that bladder. Well, the bladder starts changing what it's made out of. Just like when you go to the gym. If you go to the gym every day, the first time you go to the gym, no one's going to notice. But if you keep going to the gym every day for the next 90 days, well, your muscles are going to get more and more large. The reason why is because your muscles figure, well, I'm not just going to open the door today. I'm going to be lifting 100 pounds, and all of a sudden your body starts changing the composition or the number of muscle fibers in order to prepare you for the next time you go to the gym. It's sort of like a compensatory mechanism. Well, the bladder, same thing. If the bladder figures I'm going to have to push even harder next time, then the muscles in the bladder start getting more and more strong, and that change in the composition of the bladder, of muscle and collagen and the nerve tissues starts changing. The bladder stops being a pliable, they call it yoga bladder, and starts becoming a bodybuilder bladder. And that's when it starts, doing all sorts of things you might not like, including going into spasm, or including not emptying all the way, or getting up at night to urinate, or you think you want to pee and you go to the bathroom and it takes you 5 minutes to get it out, or the flow starts to get slower and slower. Those are all signs that it's not as easy as it was to get the urine out of the bladder. And there are solutions for every single one of those problems, but you need to recognize it when it happens, because if you don't and you just let it go, I've seen this month 3 people who presented with urinary retention. Those are people where the bladder, it worked too hard for too many years, and all of a sudden it basically gave out. It's no longer capable of urinating at all. And that's when you feel your bladder is full, and it hurts, and you want to pee and you can't because the bladder is not getting the urine out at all. So if you recognize some of those symptoms, it's better to get checked out earlier than later, so that way you keep your bladder from completely decompensating and completely giving out. Get checked out and get treated for this condition.